Hey guys, so now we're going to go over some emergency airway management for the laryngectomy patient. It's important to remember that your laryngectomy patient no longer has any connection between their nose and their mouth and their lungs. The only connection they have to their lungs is right here at their stoma site. So you come into the patient's room and the patient is in distress. What do? Look at your laryngectomy emergency airway management chart. First thing, you're going to want to call your respiratory therapist. Is your patient breathing? If they're not breathing, call the CPR team right away. If they are breathing, you're going to want to apply oxygen via the trach mask. I got my helper here, Joni. She's going to come in. We're going to check some vital signs, put on a pulse ox, and apply some oxygen. First thing you want to do is assess the patency of the stoma. In order to do that, you got to see if you can pass a suction catheter. Your tracheostomy, laryngectomy supplies are in the drawer over here. Got a 14 French suction catheter kit. I'm going to open it up, use sterile technique. Get my gloves on. Got my suction catheter, and I'm going to attempt to pass the suction catheter at this point. Plug it into suction. Oh, sorry. And attempt to pass the catheter. If you can pass the catheter, follow over here. The laryngectomy stoma is patent. You'll perform endotracheal suctioning at this point. And consider a partial obstruction. They could still have some kind of a plug down there, and ventilate with a bag mask if they're in distress at this point. If you cannot pass a suction catheter, follow down this way. It says if a tracheostomy tube or laryngectomy tube is present, which this patient does have a laryngectomy tube, we're going to check out this inner cannula and see if there's a plug in there. In order to remove the inner cannula, you want to pinch the sides and gently pull out the inner cannula piece. If there's a plug, you'll see it inside this tube here. If there is a plug, you're going to want to replace it with a clean one, which will be in the drawer here. If there's not a plug in it, go ahead and put it back in. So is the cannula patent? Yes. Continue to support ventilation and oxygenation via the resuscitation bag on the stoma. If the cannula is not patent, you'll want to replace it with a new one. If there is no inner cannula, so you have a patient who just has a stoma, but they do not have a tracheostomy tube inside of it, you're going to want to ventilate the patient via their stoma hole. We use a neonatal or a pediatric mask. It'll be a smaller than normal mask on the end of the ambu bag, and place that over the stoma and ventilate that way. Continue to ventilate until the team gets here. That's it.